The overriding goal of our department is to promote the health and safety of the individuals we serve and to maximize their independence in everyday life using necessary supports. These supports could be anything from adaptive equipment and assistive technology to providing trainings and conducting assessments. Those supports then enable people to be active members of their community.
The support that we provide people allows them to live the lives like people without disabilities, and they deserve that.
So we're going to go over a little bit of general anatomy and physiology.
Health Supports and Provider Relations has three main responsibilities. First, the department provides training for the individuals served, their caregivers, and service providers. Second, it provides consulting and assessment services related to occupational therapy and nursing services for individuals and providers. And finally, the department supports service providers in meeting rule and law regulations.
It's also important for somebody who cannot do it for themselves that we provide mouth care.
Service provider training covers a variety of subjects, including medication certification, CPR, first aid, and other important topics. Individual and caregiver training can include content such as hygiene, mealtime assistance, behavior strategies, adaptive equipment use, and other specific tasks. All training is provided at minimal or no cost.
Keeping that zero threshold in the shower is important to allow someone in a wheelchair to be able to get in that way with the appropriate grab bars and a handheld shower so that they can use it while sitting.
Okay. And in the living room area, we have the same low pile carpet being planned to be installed there. And then when you go into the kitchen area,
the assessments provided by our team of professionals evaluate key factors such as cognition, medication administration, physical abilities, sensory needs, level of independence, and accessibility in all areas of the individual's life. These recommendations can result in adaptive equipment or other support to maximize the individual's independence.
We're not just making the decisions about them, we're making them with them. So we ask them questions, what is it that you need? And we really try to gear those things so that we're supporting them in the ways that they want to be supported.
If you all flip through, you guys have the PowerPoint in your binders. Every year you have to have annual training on behavior support because you're both providing HPC services.
Our department also supports Wood County's network of service providers. This involves consulting with independent and agency service providers to ensure proper certification and compliance with all Ohio rules and regulations. Monthly meetings are hosted to facilitate networking and partnering within the service provider group.
I find the meetings valuable for updates, for their needs, for our needs. They do bring in trainings there also. They have great attendance from their staff. I think it's a huge benefit that they offer us.
Individual service plans, or ISPs, are also reviewed to ensure that they are person-centered, meaning the individual's wants and needs drive the plan.
Every decision we make, from our board of directors, from our superintendent, from our leadership team, from our staff, frontline staff, we all very much care about people we serve, and every decision we make is geared to their best interest and what they want.
If you'd like more information about health supports and provider relations, please call or email us today.